I created the Alliance of Wound Care Stakeholders 20 years ago. It's our 20th anniversary. It's so hard to believe because it was important to be able to have a united voice for wound care. I got the idea when I was talking to one of the staff at the Centers for Medicare and Medicaid Services, because he was telling me that he would have various clinical associations come to him with a similar problem but different solutions. And he said it would be great if there was some united organization that could come to us that represented all these associations, united front, and we're happy to be able to work with you that way. So that was my aha moment 20 years ago when I thought, well, let's see whether we can get all these clinical associations. And right now the Alliance has 20 different clinical associations whose members treat patients with chronic wounds. But I got them all together in a room and I said, what are your most important legislative and regulatory priorities? And there were always coverage, coding, and payment, all the reimbursement areas, wound care education, wound care research. And so I thought, well, I think we can work with that. If everyone's really interested in being part of such an organization, we can form one. So we called ourselves the Alliance of Wound Care Stakeholders, and we've been together ever since. We're a 501c6 trade association, and we not only represent wound care clinical associations, but also non-clinical association and business entities. And we just added some new membership categories, such as wound care provider groups and as well as wound care clinics. It was really very interesting because Dr. Carolyn Fife said to me, what if the Alliance didn't exist? What would happen? Well, there really is not one united voice for wound care that would go to the Centers for Medicare and Medicaid Services or the Food and Drug Information and be able to speak, again, with one voice about all the different issues that really do confront the wound care community. So the types of things that we do is addressing coding, coverage, and payment for wound care procedures and as well as products or as well as services. So what's kind of funny is when I talk to any of the staff at the Centers for Medicare and Medicaid Services or FDA, and I'd say, well, what's on your desk? Because whatever's on their desk that deals with wound care, I know that I'm going to be getting a memo or something like that shortly, and we're going to need to act on that. So we've had a tremendous number of successes over the years, and addressing any particular type of issue that will come out from CMS. For instance, in the next few weeks, we're going to have all the published proposed rules come out from CMS, from home health as well as the physician fee schedule, the outpatient prospective payment system. All of them have different components on it that really do affect wound care clinicians, wound care business entities, whether it's dealing with negative pressure wound therapy or cellular and or tissue-based products for skin wounds or debridement. And so what we do is when some of these proposed rules come out, I have my colleague Karen Ravitz and I look through these rules, which are about 1,000 pages or so, comb what's necessary for wound care, create a summary of it, submit it to our members, and if there's issues that could possibly limit any type of coverage or coding or payment for any of these products or services, we're the ones that write the comments, we share them with our members, and we submit them to the Centers for Medicare and Medicaid Services as well as the contractors called the Medicare Administrative Contractors. So if the Alliance didn't exist, there may have been no other trade association or no other entity that would have been able to advocate on behalf of wound care clinicians, wound care business entities, wound care clinics to ensure that patients are going to get what they medically necessary need from in the wound care space. So, some of the successes, have certainly been in ensuring that the wound care products have been covered and coded and paid for, appropriately. Many times when you're advocating on behalf of a particular product or technology, things don't always happen automatically. it takes many years of advocacy, submitting comments to the federal agencies to ensure that your voice is being heard. One of those is dealing with the cellular and/or tissue-based products for skin wounds, otherwise known as skin substitutes. So one area that has been under a lot of, I guess, scrutiny is the payment for these particular items, with CMS. And we've submitted comments, over the past few years to both the hospital outpatient area as well as the physician area. And what we just did recently, which we will find out how the agencies look at what we're doing, is we had asked the various 3 different divisions of CMS to be able to have a conference call with us, because what has transpired in the HCPCS coding area of CMS had unintended consequences in the physician area as well as in the hospital outpatient area too. So 3 weeks ago, we had this fabulous call. Very seldom do you ever get the heads of the divisions of 3 various areas of CMS and 20 different staff people to be on a call with you to be able to understand how an outside organization such as ours can give them insight on the consequences of their actions in one area and how it affects another. So that was what we were doing in the realm of cellular and/or tissue-based products for skin wounds. We will find out in the next few weeks when the proposed rules come out, for these particular products, if we made any headway, and that was, really a big highlight for us. We've also been doing a lot of work in the National Correct Coding initiatives, the procedure-to-procedure edits to allow clinicians to be able to bill for both a procedure and a product on the same day. We're working on that particular issue. The priorities for this year were the summit was actually, number one. One of the areas that we are updating is I had a few years ago, many of our members had said, it's very interesting. When I go up to the podium, I really don't have the actual numbers of how much it costs Medicare to pay for a chronic wound. So again, it was another aha moment. And a few years ago, we took the 2014 Medicare database and we created and we created a paper that was published in Value in Health, and it's actually on our website, that talked about what the expenditures were for Medicare for venous stasis ulcers, diabetic foot ulcers, and a number of these different chronic wounds. And one of the priorities for this year is we are going to update that particular paper because of the fact that there is now data for 2019 and 2020 that we are going to be using. And we're using both of those because we're going to see what the effect of COVID is, from 2019 and 2020. One of the other areas is our Wound Care Evidence Summit that's going to be in Bethesda, Maryland, May 19th through 20th. And we got the idea of doing this because the Alliance is really not in the conference business. But as it turns out that so many of our members had said to us, Marcia, you have a great relationship with the Centers for Medicare and Medicaid Services. You can pick up the phone and contact somebody in the coverage area and they're going to talk to you. They will call you back. Yeah. But with the commercial payers, United Healthcare, Anthem, Blue Cross Blue Shield, we really don't know what they're thinking. And so it would be wonderful to find out from them what type of clinical evidence, how much clinical evidence is necessary for them to give a positive coverage decision on any type of wound care products or procedures. So I thought, well, that might be really very interesting. So we have a very dynamic 2-day meeting that starts with a number of different entities talking about their thoughts on wound care coverage and what are the expectations, what are the opportunities going forward in wound care research. And we actually have somebody talking about what are some of the gaps in wound care evidence and talking about wound care in general. That's Dr. Marcia Carter, and she is going to be joined by a well-known oncologist from City of Hope, addressing how wound care patients and oncology patients may be very, very similar when you're doing research studies, and how wound care can learn from the field of oncology. Some other, we're going to have 4 different payer panels that's going to react to what they have heard earlier, but talking about coverage, issues and how they make their actual coverage decisions. We're also going to talk about real-world data and what's the difference between real-world data and real-world evidence, and how, again, wound care can benefit through it, perhaps working with various registries. It's going to be just a dynamic meeting. So. Wound care clinicians can get involved with the Alliance. Anyone can look at our website, www.woundcarestakeholders.org. We have a tremendous amount of information on that website. We always ask them to be able to join their particular clinical association. So many of the clinical associations are our members, and I believe they pass on a lot of the information and all the advocacy that we do in this area. And there's a number of different membership opportunities for clinicians, and they fit in one of those membership areas, and we would love for them to be a member of the Alliance.